Well, good afternoon. This is Dr. A, and I am a medical doctor who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to improve your quality of life. Well, hello, hello, hello. Hi, everybody, and thank you so much for joining me this afternoon. And if you are here live, please type hi in the comments below. And if you're coming back and watching the replay, please type replay in the comments below. So if you're here now, hi, later, replay, and I would love to know that you're here. Also, if you have any questions along the way, please feel free to type them in the comments, and I will do the best of my ability to answer them. So, for the last few weeks, I have been talking about different hormones and the effects that they have on our health, how they can change with age, and how they can help affect our weight. Well, last week I talked about the hormone cortisol and how it actually increases with age, and how this can cause symptoms such as irritability, fatigue, and weight gain. Well, today I would like to discuss the other end of the spectrum, which is when the cortisol level is low, and how this can also lead to weight gain. So I'm sure that you probably have questions, know other people who have the same kinds of questions. So please be sure to share this video. And if you would like to schedule some one-on-one time to discuss your hormones or your weight, please feel free to visit our website at prohealthservices.org and click on the button to schedule a consult. So today, as I said, the discussion is talking about low cortisol, which is also known as adrenal burnout or adrenal fatigue. Well, when we are in stressful situations, our body normally has our cortisol level go up to deal with that stress, whether it's an emotional stress or a physical stress. But then after that stress is over, the cortisol level is supposed to come back down. Well, this doesn't always happen the way that it's supposed to. And we talked last week about how if the cortisol stays high, that can cause symptoms such as weight gain as others. But if the cortisol stays high for a long period of time, then our body loses the ability to produce more cortisol, and then the cortisol level starts to go down. And this is often referred to as adrenal fatigue or adrenal burnout. And one extreme form of adrenal fatigue is Addison's disease, which is the extreme, but there's a big spectrum of when the cortisol level is low to Addison's. There's a whole bunch of symptoms along the way and a whole bunch of people who fall in that spectrum. So, what are some symptoms of low cortisol? There are very many of them and include things like fatigue, anxiety, poor stress tolerance, meaning it's difficult to respond to stress, hypersensitivity to the environment, meaning you may be sensitive to light or to sound, absent-mindedness or forgetfulness. And so think about how many people experience that. Feeling spacey or confused, just not thinking clearly. Depression can definitely be a symptom of the cortisol level being low. Paranoid feelings, feeling really irritable or feeling hostile, just kind of negative emotions towards other people. Concentration problems can be a sign of the cortisol being low. And we've talked before about how that can also be other hormones being low, but this is cortisol in that mix. Insomnia or problems sleeping can be a result of the cortisol being low. Digestive problems and low blood glucose, which can cause people to feel shaky and weak. Decreased libido can also be a symptom of low cortisol. And also unresponsive hypothyroidism. And what that means is that if a cortisol is low, your body may not respond to thyroid hormone appropriately. And we've mentioned before how thyroid hormone plays a very important part in weight gain and energy metabolism. So if you're not responding appropriately, you can actually have weight gain as a symptom of the cortisol being low. In addition, feeling overwhelmed and really struggling to deal with that can also be a symptom of the cortisol being on the low side. So, how do you know if it's low? Well, the best way to find out would be to do a saliva test where you would check your saliva several times throughout the day, and that would get sent to the lab and they would measure your cortisol level. And that would help determine, is it low all day? Is it not rising appropriately the way that it's supposed to? And give a lot of insight. And we actually have the kids to do that testing available here in the office that we can get to patients when we do a consult talking about their hormones. So if you find out that your cortisol is low, well, what can you do about it? How can you raise it? We start off by talking about nutritional support, different kinds of vitamins that help, such as B complex, the B vitamins, B12, vitamin C, and vitamin D. Omega-3 fatty acids are also helpful, as is magnesium. We also talked last time about adaptogenic herbs, which are different things like rhodiola and ginseng, which can help if your cortisol is too high, but they can also help if your cortisol is too low and help your body respond better to the cortisol that you have. There's also adrenal extract, where adrenal gland is ground up, and then the hormones within that extract people can consume to increase their cortisol level. Phosphatidylserine is another adaptogenic herb that can help with the cortisol being low. DHEA can help. And then sometimes patients simply need compounded cortisol because their level is so low that the only way to get it higher is by having a compounded prescription. So low cortisol can cause so many problems that, again, irritability, problems sleeping, weight gain, and it's very, very common. But the good news is that there is safe and effective treatment available. One of the keys is simply being able to make the diagnosis. So to summarize, cortisol is a hormone that normally goes up when we are stressed, whether it's emotional stress, physical stress, and that's our body's natural response. But it's supposed to go back down when the stress is over. However, if it stays high for extended periods of time, that can then cause our body to lose the ability to make cortisol. So it can be high for a really long period of time and then all of a sudden plummet and be really, really low and be very challenging to increase it. Chronically high cortisol can wreak havoc in our body, which can lead to weight gain. But also, as I said, if it's low, that can also lead to weight problems because it interferes with our thyroid, and thyroid plays a very important role in metabolism. Well, treatment for cortisol abnormalities is available at Pro Health Services, and we would love to help you get some symptom relief. So if this information was helpful for you, or if you learned something new, please type helpful in the comments below. And again, please be sure to share this video because there are so many people who suffer and who have no idea where to go for help. And we would love to be able to help patients feel better. In addition, you can feel free to subscribe to our free newsletter. If you go to our website, prohealthservices.org, click on where it says newsletter, and you can get our newsletter, which is packed with wonderful information and sometimes has some perks in it. So imagine, if you will, what your life would be like if we worked together and got your hormones balanced, helped your cortisol go to where it was supposed to be, you had an easier time losing weight, you may have had more energy, improved memory, able to think clear, possibly improved libido or improved function. I would love to help you get there. And so again, please visit prohealthservices.org and click on the button to schedule a consult or give us a call at 614-442-2600. Thanks so much for joining me this Thursday afternoon, and I will be back next Thursday at 12:30 p.m. Eastern Standard Time. Bye for now.